So marginal zone lymphoma is an interesting subtype of lymphoma, not very common, 5 to 8% of all lymphomas, but it is a spectrum disease, and we have learned a lot over the last actually 4 decades when we first realized that what we call now the IPSID for immunoproliferative small bowel syndrome, which is actually related to Campylobacter jejuni overproliferation and antigenically driven process. We have learned a lot over the years and identify actually a number of those lymphomas that are antigenically driven. So the most typical and well studied and characterized one is actually H. pylori related gastric mold lymphoma. So we have learned from this and trying to treat the trigger. We can actually, in many situations now, have the lymphoma regress unless the lymphoma has evolved enough without transformation, but acquired enough genomic abnormalities to become antigen dependent. So we have learned a lot about this is a great model for lymphoma genesis. It's also a very heterogeneous disease clinically. So there's 3 main types. There's the mold lymphoma, which I mentioned, the gastric mold, which is related to H. pylori. That has usually very good outcome. We have other antigenically driven process from infection, for example, Chlamydia psittaci that has been related to ocular adnexal lymphoma, mostly in Europe actually, not really in the US. And we also have skin mold lymphoma that has been in some situation again in Europe linked to Lyme disease basically, and can be also treated with antibiotics. And finally, we also have the equivalent in bulk lymphoma or mold lymphoma of the lungs. So all of these can happen in any organs. This is part of what's called mucosa-associated lymphoid tissue, which is the largest number of lymphocytes around the body in the mold tissue. And that can happen after a chronic stimulation that generates enough mutation to drive the cell into a cell that becomes a cancer cell. And over time, the cell loses the need from the stimulation from the antigen and can become independent lymphoma, not responsive to antibiotics, and potentially transform. So we have also learned a lot in marginal zone lymphoma is that we have started to tackle a little bit the molecular heterogeneity of those lymphomas with many different translocations we're not going to review here, but again that made the process antigen independent and can have also prognostic value.